Assalamualaikum and a very good evening to our beloved lecturer, Dr. Siti Zafira and fellow friends. I'm Nur Fatini, together with my groupmates Camelia and Nadira, will unveil to you the application of optical fiber in medical. So, what is optical fiber? Optical fiber is the technology associated with data transmission using light pulses that pass down a long fiber, which is often comprised of glass or plastic. For your information, there are two primary types of fiber. Each has a wide range of applications. These are single-mode fiber, which only has one root via a much smaller core, and multi-mode fiber, which has a big core and allows for several channels through the fiber. You guys must be wondering what principal optical fiber works. Basically, optical fibers utilize the total internal reflection optical concept. Now, let's talk about optical fiber in medicine. Generally, medical fiber optics are a vital medical technology used in many medical specialties. Although fiber optic technology got its start in endoscopic imaging, where it obsoleted many types of invasive surgery, it is now a critical component of many types of medical instruments. To let you guys get a clearer view, me and my friends will discuss about endoscopes, surgical fiber laser, and CT scans.
Assalamualaikum warahmatullahi wabarakatuh, and my name is Nur Adira Kamila binti Abdurrahim. My student ID is 20213522685. Now, I would like to start about the first application of optical fiber, which is in endoscope. Endoscopy is a medical procedure that allows a doctor to inspect and observe the inside of the body without performing any major surgery. Optical fibers are flexible and transparent fibers with a diameter just a little bigger than a human hair. They are primarily used for transmitting light. In fiber optics, a core is usually surrounded by a transparent cladding material with a lower index of refraction. The way light is transmitted in fiber optics, which allows doctor to use endoscopes to see the body's interior, depends on the total internal reflection principle. Colored light is used by some endoscope to detect precancerous abnormalities in the esophagus lining. Narrowband imaging is the term for this type of imaging. Light is carried into the body cavity by a light fiber, and the image of the body cavity is returned to the physician's viewing lens by an image fiber. Usually, an endoscope is inserted through one of the body's natural openings, such as the mouth, urethra, anus, or esophagus. Fiber optic endoscopes are flexible, highly maneuverable devices that allow access to bodily channels that older, semi-rigid instruments that cannot access at all or can only access with severe discomfort to the patient. Uses of endoscope is to evaluate stomach pain, ulcers, gastritis, or difficulty swallowing, digestive tract bleeding, changes in bowel habits, chronic constipation or diarrhea, and polyps or growth in the colon. Depending on the condition under investigation, some endoscopies can be carried out in the doctor's surgery. Others need a trip to hospital or day surgery facility and may require a general anesthetic. Endoscopies are generally painless, although they may still cause some discomfort. Compared with the stress experienced by the body in a full surgical procedure, an endoscopy is simple, low risk, and cost effective. Endoscopy has a much lower risk of bleeding and infection than open surgery. Still, endoscopy is a medical procedure, so it has some risk of bleeding, infection, and other rare complications such as chest pain, damage to your organs, including possible perforation, fever, persistent pain in the area of the endoscopy, and redness and swelling at the incision site.
Hi, my name is Nadira binti Hamad. I will move on to the second application of optical fiber in medical, which is surgical fiber laser. Everyone must be wondering how a laser can perform a surgery. Please allow me to explain. Because optical fiber are non-toxic, chemically inert, and fundamentally safe, they are ideal for use in around the human body and ability to perform surgical procedures. So how does it work? Surgical fiber laser works by pump light from fiber laser come from so-called laser diodes. The fiber optic cable receives the light and this diode emits. Then a curtain wavelength is produced and amplified using optical components found inside the cable. The final step is to shape and release the generated laser beam based on total internal reflection principle. The single mode fiber laser beam enables the coupling of higher powers into smaller and more flexible optical fiber, free up the valuable space in the uteroscope single working channel for improved saline irrigation and allowing the ureteroscope to be more flexible for accessing difficult to reach areas such as the lower pole of the kidney for stone treatments. In general, laser fiber for use during surgery may be inserted in the body to eliminate internal wounds. Conventional fiber optic devices, which are made from glass or plastic, remain in the body indefinitely until surgically removed. However, because they can reabsorb into the body, this fiber can heal wounds without the need of removal or additional surgery. Surgical fiber laser is all-in-one tool that can photograph, diagnose, and perform surgery. This product will include the most advanced laser-induced breakdown spectroscopic imaging technology, which will automatically identify material like soft tissue, hard tissue, or metals, and then perform the appropriate methods. For example, cutting, ablating, or cauterizing hard-to-reach part of the body with as little tissue damage as possible. There are numerous benefits to using surgical fiber laser. When compared to the traditional surgical method, one of the advantages is that it reduces the risk of damage to adjacent tissues. As a result, healing time is reduced and post-op discomfort is reduced. Not only that, laser can be inserted in the body with the little risk of discomforts, going place and performing surgeries that are virtually impossible. Last but not least, computer-guided laser can eliminate human error in surgery. Despite its many benefits, there are some drawbacks, including the fact that it's expensive for patients and as a result, require more consultation from patients who require laser-based medicine. Furthermore, higher force during the cutting cycle. A minor error in changing distance and temperature may result in metal copying or staining. Last but not least, optical spectrum pulse pedestals are not ideal for higher energy pulse.
Thank you, Camelia and Nadira. Now I will explain the last application for today, CT scan. Computed tomography, or as known as a CT scan, displays more information than a standard X-ray. Bear in mind that we have 5 generations of CT scans, but in this video, I will just explain the 3rd generation. As you can see, this picture shows the 3rd generation. So, how does it work? CT scanner use a motorized X-ray source that shoots narrow beams of X-ray as it rotates around the patient. This provides a series of images from many different angles. The X-ray beam hits a row of detectors wide enough to image the whole slice. A commonly used detector system is the so-called energy dispersive scintillator detector. Each pixel of the scintillator panel captures X-rays and converts them into light images. Fiber optics transfer this image to a charge-coupled device sensor where the light is transformed into an electric signal. Then, the computer stacks the scans one on top of the other to create a detailed image of organs, bones, or blood vessels. What benefits do CT scans offer? First, they can detect bone and joint problems like complex bone fractures and tumors. Other than that, if someone has a condition like cancer or heart disease, CT scan can spot it. Also, they could show internal injuries and bleed, such as those caused by a car accident. Not to mention, they are used by doctors to direct treatment plans and operations, including radiation therapy, surgery, and biopsies. Worry not, CT scans offer shorter recovery periods. They are very fast and only take a few minutes, so it's a lot easier. Next, CT scans have no exposure to anesthesia and less risk of infection. Last but not least, a CT scan is a very good for imaging bone structure. Then, what are the disadvantages of CT scan? CT scan use X-rays which produce ionizing radiation. According to research, this type of radiation may harm your DNA and cause cancer. However, the danger is still incredibly low, about 1 in 2,000. In addition, some people are allergic to the contrast material. Most of the time, the reaction is mild. It can lead to itchiness or a rash. In very few cases, the dye may trigger a life-threatening reaction. Now, let's hear what Nadira has to say.
To summarize, optical fibers, as discussed in this section, is a medium for transmitting information in the form of light from one location to another. It is a useful, practical, versatile and powerful technology that has assisted humans throughout history in performing visual examination, diagnostics and therapeutics on both sick and healthy patients. Optical fibers are classified into two types, which are single-mode and multi-mode fibers based on total internal reflections. The superior capabilities of fiber optics in transmitting a wide range of the communication signals infiltrating medical system, which require temperaturability, height stability, safety, and biocompatibility, providing numerous options for medical equipment developments. Opti has been and will continue to be an enabler for medical advancement, allowing for the development of previously unimaginable new device, techniques, and the application in not too distant future. With this in mind, we hope that this video presentation will provide viewers with a basic understanding about optical fiber in medical and their application to this. That's all from us. Thank you.